Dangerous brain stroke mistakes almost everyone makes. Did you know that before a stroke happens, not with a loud bang, but in complete silence, your body may have already been quietly crying out for help? Not with a drooping face, a weak arm, or slurred speech, but with subtle signs so small they're often ignored. A sudden unexplained fatigue, a strange sensation that lasts just a few seconds, or a brief moment of dizziness that seems harmless. Why are these signs so important, yet so often overlooked? Because they are early warning signals, highly refined, often appearing 7, 14, or even 30 days before a stroke actually strikes. The scary part is, up to 90% of us miss these warnings every single day. So what would you do if you knew that right now, as you're reading this, your brain, which makes up only 2% of your body weight, is using 20% of your energy and cannot survive more than a few minutes without blood? What would you change if you realized that even a few minutes of delay could take away your ability to speak, to move, or even your life? Every second during a stroke, millions of brain cells are destroyed, and once brain cells die, there's no way to bring them back. That's why understanding early warning signs and acting quickly is absolutely critical. In this video, you'll discover the pre-stroke symptoms that are extremely easy to miss, understand why the brain is so incredibly fragile, and most importantly, learn how to protect yourself and your loved ones with simple, science-backed steps that can reduce your risk by up to 80%. Ask yourself, why do some people suffer a stroke while sleeping? Why do others suddenly collapse after only a few steps? Maybe it's not because they were weak, but because they had been living for too long with silent killers like high blood pressure, diabetes, high cholesterol, chronic stress, smoking, or being overweight, things we often accept as normal. But have you ever wondered if those conditions are truly normal? Why do millions of people die from strokes every year? Don't wait until your body screams in pain to finally pay attention, because by then, it might be too late. At the end of this video, I will share one simple principle you can apply every day to quietly build your own armor against stroke. Don't skip this, because one insight you gain today could save your life or the life of someone you love tomorrow. The truth is, we're living in a matrix of intertwined risk factors. Processed foods, a sedentary lifestyle, constant stress, even air pollution. Are you unknowingly inviting this enemy in? And the aftermath of a stroke is truly devastating, not just for the patient, but it's a heavy burden for families and society too. Health collapses, finances are wiped out, and spirits are crushed. So what? Understanding this isn't meant to scare us, but to show us that every preventative action, no matter how small you take today, is truly priceless.
So, how do we get a read on this invisible enemy? First, you need to know that a stroke has two main scenarios. One is a blocked blood vessel in the brain, called an ischemic stroke, which is the most common type. The second is a burst blood vessel in the brain, called a hemorrhagic stroke. This is less common, but often more dangerous. Whether it's a blockage or a burst, many of the initial signs can look very similar. So how does the body sound the alarm before a stroke? One of the clearest warnings, a shout you can't ignore, is a transient ischemic attack, or TIA for short. Many people still call a TIA a mini stroke and then get complacent. But listen, a TIA is anything but mini in terms of its warning power. The symptoms of a TIA are exactly like a full-blown stroke. You might suddenly notice your face drooping a bit, your arm or leg feels weak, or you find it hard to speak. The difference, and this is what tricks people, is that these symptoms only last for a short time, usually a few minutes to less than an hour, and then disappear completely. Because it's just transient and then gone, many people just shrug it off, thinking it's probably nothing, but that's a huge mistake. The risk of having a real stroke right after a TIA is incredibly high, sometimes within just a few days. A TIA happens when blood flow to the brain is temporarily disrupted before permanent brain damage occurs. That's why a TIA is a medical emergency. It's a golden opportunity for doctors to find the cause and intervene with preventative measures, stopping a bigger disaster. When TIA symptoms appear, or when a real stroke hits, there's a very easy-to-remember rule that will help you quickly recognize it and act decisively. That rule is called F.A.S.T. Let's start with the letter F, which stands for face drooping. Ask the person to smile. Then observe if one side of their face shows signs of drooping or if their mouth is crooked. Next is the letter A for arm weakness. Ask the person to raise both arms out in front of them. See if one arm drifts or if they feel one arm is significantly weaker. Then comes S for speech difficulty. Is the person having trouble speaking? Are they slurring, mispronouncing words, unable to form a complete sentence, or even not understanding what you're saying? And T is the most important. Time to call 911. If you notice any of these signs, even just one, don't hesitate for a second. Call 911 immediately. The F.A.S.T. rule is also exactly how you can spot a TIA. Even if the symptoms disappear on their own, their appearance is an extremely serious warning sign. Also, if someone suddenly loses their vision, gets so dizzy they can't stand, or has a headache they've never experienced before, those are also signs that you need to get them to the emergency room right away.
But did you know, even before those clear shouts like a TIA or F.A.S.T. signs show up, the body sometimes whispers warnings much earlier. These signals can appear days, weeks, or even months before a major cerebrovascular event actually happens. These are the signs of a stroke before it happens that we need to learn to listen to very carefully. These whispers are often very vague. They come and go, making them easy for us to mistake for everyday discomforts. But if you're someone with stroke risk factors like high blood pressure, diabetes, heart disease, or if you smoke or are overweight, recognizing these early signals could be a life-changing factor for you. Pay close attention to any new, repeated, or worsening changes like these. It could be a new type of headache, or the nature of your usual headache suddenly changes in an unusual way. Or it might be a fleeting sensation of numbness, or slight weakness in your face, one arm or one leg, lasting only a few seconds or minutes, then disappearing, but it might happen repeatedly. It could also be brief moments where you feel slightly dizzy or momentarily off balance. Sometimes it's a fleeting difficulty finding words, or you find yourself stumbling over words a bit. Brief visual disturbances like sudden blurry vision that clears up, seeing unusual flashes or dark spots, or experiencing double vision for a moment are also signs. An extreme, unexplained fatigue, completely different from normal tiredness, also needs attention. So how do you tell these whispers apart from everyday aches and pains? The key is to observe changes from your normal state, the repetition of these symptoms, and especially their appearance against the backdrop of any stroke risk factors you might have. If you have several risk factors and you start noticing these new repeating symptoms, that's when you absolutely need to take your body's signals seriously. Knowing about these subtle signs isn't meant to make you live in constant panic or fear. Quite the opposite. It gives you a powerful tool, proactive awareness. It helps you recognize when a symptom you might have brushed off as minor actually needs to be shared with your doctor. Keep the emergency number 911 somewhere easy to see. If you or a loved one has underlying health conditions, always have a current list of medications handy. Know in advance which nearby hospital has a dedicated stroke unit. Even better, mentally walk through a quick action plan for your family in case of an emergency. This preparation is never a waste. It can make a huge difference. Preventing a stroke might sound like a daunting task, but I want you to see it differently. It's not a life sentence of boring restrictions. Instead, think of it as an exciting journey to redesign your lifestyle, building a fortress of health, one small, sustainable brick at a time. It's about the freedom you choose for your own well-being.
It could be as simple as adding an extra 10-minute walk to your day, choosing one healthier meal during the week, or cutting back a little on salt. Those small things have tremendous power. If a stroke does unfortunately happen, the road ahead can be challenging, but please never give up hope. Recovering from a stroke is more than just exercises to regain lost function. Many survivors have shared that it's like a rebirth, a journey of rediscovering themselves, finding incredible inner strength they never knew they had, and sometimes even redefining the meaning of life. For those of you who have gone through a stroke or are supporting a loved one, what's the biggest lesson you've learned or the strongest source of motivation you've found? Your share in the comments isn't just meaningful for you, it can inspire and give strength to so many others who need to hear it.